Okay. All right. Welcome, guys. Thank you so much for coming to our first in at least a while virtual with the vet. I'm super excited about this. We have been trying to do more topics for everybody about some of the things that are going on behind the scenes, some of the things that volunteers might be concerned about, just to give you guys a place to ask questions and really like understand what's happening so that you're not fearful of these things that are happening, or if you are, then we can give you some tips and tools around that. So this time our topic is, what is PanLeuk? You've probably heard that a little bit around the shelter, especially if you are a foster person or you work in our unevaluated cat areas. You've probably dealt with that at some point or another with quarantine rooms. So Dr. Garrity is here to talk with us about that. Dr. Garrity, if you want to go ahead and give kind of an intro of who you are and how long you've been working with us and all that fun stuff.
Yeah, I'd love to. So I think I've met most of you, but I'm really happy to be here with you guys. I have worked for Michigan Humane for the past 12 years, coming up to 13. And I previously worked in Rochester Hills, originally as a clinic vet. And then when the shelter vet position became available, I moved into that area. And then I have been at Westland for about 3 months now. And, I'm just happy to meet a whole new set of volunteers and fosters. I think that's it on the intro. Let's go to the first slide. So we're going to talk about panleukopenia virus, which is definitely a hot topic. It is something that we see most commonly in the warm months, but that's just because our populations are larger then, and more cats are out and about and being exposed to it. So it's a really contagious virus. It's related to the canine parvovirus, so it's sometimes called feline parvovirus. They do not infect people, and they generally don't cause symptoms between dogs and cats, even though the viruses are related. And it likes to target cells that rapidly divide. So its favorite places are generally going to be the lymphoid tissue, the bone marrow, some of the crypt cells, or the cells that are within the intestines. And in pregnant moms, the fetuses can be affected. So sometimes we can see abortions, stillborns, or sometimes if you've seen those cats with the wobbly heads, it's called cerebellar hypoplasia. If the kittens survive and their mom was pregnant when she was infected or early in their lives, they can have that bobbing head or sometimes that wobbly gait, or the way that they walk is really goofy, but they live totally normal lives if they have that condition. Next slide. The panleukopenia virus is typically most spread in feces and vomit, but it can be spread in all the secretions. So the way that we see it happen is that young kittens are most affected. So anything under 5 months old is the most vulnerable. Unvaccinated adult cats, or cats whose immune systems are being suppressed by something like some of the retroviruses like feline leukemia or FIV viruses, those cats are all the most susceptible, although every cat, even the large cats we see in zoos, so tigers, lions, they can be affected by FPV. And the reason that it says up here that we most commonly see it at 3 to 5 months is because of the maternal antibodies or the passive immunity. So at that age, they have the least amount of protection from their moms from nursing off of the colostrum. And so they're most at risk for some of the severe symptoms we can see. And we're going to talk a little bit more about that temporary immunity from the moms a little later in the presentation. So we'll go ahead and talk about the symptoms now. I think most people think about vomiting and diarrhea, kind of similar to canine parvovirus. So that's what we usually think about. But a lot of the times, the first signs that we're seeing in the shelter is a kitten or cat that is generally depressed or lethargic. So a lot of the times they were happy and bouncing around the day before, and now they're sitting at the back of the cage, sometimes in a crouched position because of the nausea that the virus can cause. We can also see loss of appetite. So maybe a kitten that's now quiet and in the back of the cage and also hasn't eaten, that would be a big indicator of a possible PanLeuk infection. We can also see nasal discharge. That usually happens if they have a comorbidity or another thing going on, like an upper respiratory infection. And then the dehydration occurs as a result of the loss of fluid through the diarrhea and the vomiting, also because they are typically not eating, so they're not taking in that water. Another symptom that we can see is sudden death. So they can be acting totally normally, and then we find maybe a kitten that's passed away in its cage, and that can be one of the symptoms of panleukopenia because it can strike so fast. Or on the other side of the spectrum, we can see what's called a subclinical infection, or a cat that is infected and shedding virus, but isn't actually showing any symptoms. So that's one of the reasons that this can be so hard to manage in a large population of cats, like a shelter. And another thing that we think about when we think about these symptoms is what's called an incubation period. So the period of time from the time that the kitten or cat is exposed to the virus, and then when they become first symptomatic, is called the incubation period, and it's anywhere from 2 to 14 days. So for the first 2 weeks with a cat that we don't really know their vaccine history, that would be the time that they could be kind of brewing the viral infection, and we just won't know. And it's the average time that we see is about 5 to 7 days. So they can be acting totally normal when they come into the shelter, and then 2 or 3 days later, that would be when we start to see the symptoms. Next slide. So the way that we treat PanLeuk is what's called supportive care. So we don't have any antivirals that we can use to fight off this infection in particular. What we're trying to do is to support the cats so that they can mount an immune response themselves to fight the infection off. So correcting the dehydration is the first thing that we typically do. So we can either do sub-Q fluids, which are fluids under the skin, or sometimes we will place an IV catheter. Nutrients, it's important to restore their appetites so that they can help to mount their immune response. So what we'll do is to give them things like a medication for anti-nausea, or sometimes even a pain medication that'll help to make them more comfortable and encourage them to eat, which supports their immune system in turn. Preventing secondary infections and antibiotics kind of go hand in hand. And the reason that becomes such a problem with panleukopenia is that the virus itself actually prevents the production of white blood cells. So panleukopenia means all white blood cells are low. That's what the name of the virus actually is. And because it infects the bone marrow, it prevents those cells from being formed. And since the white blood cells are the cells that typically fight off infections, it makes them predisposed to getting bacterial infections. And it simultaneously also destroys the lining of the intestinal tract so that bacteria are more able to cross that gastrointestinal blood barrier, and then they get circulating bacteria in their bloodstream, or bacteremia. So they have kind of everything stacked against their immune system. And a lot of the times what we'll do is to put them on 1 or 2 antibiotics to help prevent them from getting that septicemia. And then probably the biggest component in a shelter there is strict isolation. So these cats or kittens are either in a foster home, or if we have an isolation room available, and all the staff treating them would be wearing PPE or gowns and gloves to do any sort of handling. And the survival rate is better if they're a little older, definitely better in adults. Overall, I think the average survival rate is about 50%. But if they make it through the first few days of treatment, it's definitely better. And I would say in my hands, when I've treated this, a lot of the times it's in foster homes. 50% is true. We did a little bit better this year, maybe like 60 or 70%, but it depends completely on the animal's immune system. So whether they start eating again, and if they have other things going on like upper respiratory infections. Next slide. So prevention, this is definitely where we try to focus a lot of our attention. The passive immunity is the same thing as the maternal antibodies that we talked about. So when the kittens are nursing on their mom, they get antibodies passed through the milk. And that immunity provides a temporary protection against all the viruses that mom was protected against. So rabies, panleukopenia, it will protect them the best, is the closest to when they've nursed on their mom. That protection starts to wane or decrease as the weeks go on, and it gets to its lowest about 10 to 12 weeks. So what we're trying to do is to institute the kitten vaccine series. So we want to start vaccinating them so that we can give their immune systems a chance to mount their own protection as the mom's antibodies get lower and lower. So kittens need to receive vaccines generally starting around 6 to 8 weeks, but in the shelter, we'll do it a little earlier at around 4 weeks, just because of their high risk of exposure when so many cats are housed near each other. And then they'll need to get vaccine boosters every 2 to 4 weeks until they're around 16 weeks or sometimes up to 20 weeks, so 4 to 5 months old. And that's because every time we give a vaccine, if they still have circulating maternal protection, that will block the vaccine. But we actually have no idea if the kitten got any protection at all, because some of those kittens didn't get to drink the colostrum or maybe didn't get as much milk. Or maybe they had a mom who wasn't vaccinated, and so she didn't have any circulating protection to offer them anyway. So since we don't know any of these variables, we always recommend that kittens get vaccinated every 3 to 4 weeks until they're about 4 months old. With adults, typically we're going to do a series of 2 vaccines about a month apart, unless we know their vaccine history. And then after that, adults are considered protected and need vaccines just every 1 to 3 years. And adult cats, if you are a foster or you just sometimes worry about maybe you're bringing home contagious disease on your pants, if you have an adult cat that has been fully vaccinated, they got their full kitten series or they got a booster vaccine, they very, very, very rarely get sick. So they're a very low risk for getting a PanLeuk infection. And I've actually never seen that in my career so far, but it can happen. So overall, adult cats who are fully vaccinated are a very low risk of getting this infection. Next slide.
I'm actually going to jump in real quick, Dr. Garrity, if you don't mind.
Sure.
I don't know if we have this later in the slides, so I just want to touch on it. Another way that we obviously do a lot of prevention is making sure that people have proper PPE and, washing their hands properly and all of those things. And even our staff, when they're cleaning specific areas of the shelter, we have pretty rigid ways of making sure that those people are cleaning that specific area and not moving to another area to clean, to keep that, quarantined area from spreading any further. And I know that volunteers at Berman, especially in the last, I don't know, a couple of months, I think, we're wearing full PPE with the gowns and the gloves, handling any cats in the shelter, because we had so many concerning cases going on with PanLeuk. We wanted to make sure that we weren't spreading this anymore, just by handling the animals and moving between, even though we knew that the volunteers were not going into the specific quarantine rooms. Like we mentioned before, it may be hard sometimes to know right away if they have this. So all of the volunteers working with cats in the shelter in any capacity were wearing these items. And really that really helped, I think, keep us on the right track of making sure that we had good recovery throughout the shelter. So especially to those volunteers who stuck it out and wore those hot gowns every day, thank you so much. That is a great way to prevent that from spreading any further. All right.
So Ashley kind of touched on this already, but she did a great job of doing it. So for the volunteers, what does it mean? So in the shelter, a lot of the times, the way that we manage this inevitable problem that crops up is that we quarantine cats. So if there's a room where a cat has tested positive or is symptomatic for panleukopenia, we typically are going to quarantine the animals who are most at risk for becoming infected or becoming symptomatic. Those cats usually spend 10 to 14 days in a room where the only people who are typically going in that room are necessary staff, or if you're going in there to socialize them, you are wearing full protective equipment. So what you're wearing is usually booties, which is what covers the bottom of your shoe so that you are not tracking any invisible poop that has wound up on the floor anywhere else in the building. You're also wearing a full hot gown. They're usually not the most comfortable thing, but it protects your clothing so that when you are petting the cat, viruses aren't getting deposited on your shirt, on the corner of your cuff. Sometimes cats are rolling around and that can send pieces of litter towards your pants as you're sitting there. So it just covers all of your clothing. And then the gloves, obviously, because you are petting and interacting with them. Another thing that we typically do, or is something that we recommend, is to switch definitely gloves between each new cat. Because of that incubation period, sometimes cats can be shedding virus and they're just not showing symptoms quite yet. So that's another way that we had to try to reduce the amount of spreading that's going on. And then something else that's, you guys already do such a great job of this, but if you see something concerning, so you look at a cage of kittens, and yesterday they were bouncing around, and today maybe they're hiding at the back, or they're hiding at the back and they haven't eaten their food, and there's some diarrhea spread around the bedding, that would be a good indication that maybe don't interact with that cage, and go let a staff member know, or write it on the concern board if no one happens to be in the room at that time.
Yeah, so just to add a little bit to that with these specific bullet points that we have here, it is important through any part of the shelter to always take that extra, second to stop and look at any signage that is posted. I know in the shelter world, there is a lot of stuff posted all around. It can be easy to think that that's the same paper that we saw yesterday, but things change constantly. So please give yourself that time to just stop and look at what the signage says, because there could be new notes on it today, even if you were there the day before. Looking for rooms that have papers on the front that signify that this is a quarantined room, because sometimes depending on space in the shelter, it may not always be the rooms that you expect to be quarantined. So please always take that time to look. This is especially important for our volunteers who are working with unevaluated cats or considered level 2 volunteers. You guys might be seeing those signs first, like Dr. Garrity said, where you're kind of nervous about it. So always feel free to talk to a staff member, talk to me, talk to anyone on our team, and just say, hey, I'm not sure about this. And if you don't know where concern boards are, at Berman, they're in the shelter med area. If you've never done that before, please ask. We'd be happy to show you so that you can put this information when you see something concerning on there. I don't know exactly how they do that at Mackey, but I'm sure Sarah or Shailene would be happy to answer that for you guys. But yes, please always ask and be a little more on high alert when you see things that are not normal for you.
Okay, and then I know that a few of you are fosters as well. I just think this is one of the things that sometimes we just don't think about. Sometimes for the, when we're trying to move cats and kittens through the shelter, the best thing we can do to reduce their exposure to PanLeuk is to get them out of the shelter where there are a lot of cats and into a foster home. But that often means that they haven't been with us for that full 14 days. So they could be incubating PanLeuk and they look totally healthy now, but we just can't make any 100% guarantees. So if you foster, it's always ideal to put them in an easy to clean room for the first 2 weeks, and try to avoid areas with carpeting or, your upholstered couch, because those are areas that are just harder to clean if they were to break later. It's definitely just precautious. But if you put them in a bathroom or a laundry room that has tile or a hard surface, if they were to break with panleukopenia later, a few days later, it's just easier for you to sanitize your home to be ready to have your next litter of kittens. If kittens break with panleukopenia while they're in a foster home, we advise on how to clean those areas. If you have had them on carpet or couches, things that are upholstered, you can steam clean those areas, but it's often time consuming and expensive. And then we usually recommend waiting about 6 months before you can foster kittens again. But in that time, you can foster adult cats that are fully vaccinated, dogs, or there are some fosters who have had panleukopenia break in their house before, and they have volunteered to be the home that treats panleukopenia positive kittens in the future, sort of as an isolation home, but it's a really hard job because of that 50% success rate. Sometimes they just don't do well. So those are all just things to think about. I definitely take kittens home pretty frequently, and it is really hard to not put them on the couch with you to watch TV for the first 2 weeks. So I totally understand. It's just always a known risk that we're taking. And And then in regards to the FAQs here, when we're diagnosing panleukopenia, we're combining them with the symptoms as well as a low white blood cell count. So that means pulling blood for what's called a CBC. Sometimes they're so little that is not really possible. So we can't really get the blood because they're dehydrated. So we can detect it with what's in their feces or vomit. And that's typically what we're using is the canine parvo test. So the test we use to test for parvovirus in dogs can also pick up the feline panleukopenia virus. However, it has its limitations. We definitely wouldn't want to use it for every cat in the building. You might be thinking, why don't we just test every single kitten when they come in? And the downside to that is, one, that they're not always shedding before they're symptomatic. So there's a narrow window of time sometimes where they're shedding. So if you test too early, it'll be falsely negative. And if you test a little later in the disease, sometimes that can also be a false negative. And we can also see interaction with the vaccine. So a kitten that's been recently vaccinated can sometimes have a light positive test on that parvo test. So it can get a little bit confusing. So in general, we're only testing kittens that have symptoms. And we sort of already talked about the transmission, but the primary way that it is spread is through the fecal oral route. So the diarrhea, either, if the kittens are getting in the same litter box and one of them has panleukopenia, when they go in the litter box, they will also be exposed. But that also means for us that we can all become fomites or things that can spread the virus, even though we're not trying to. So sometimes litter scoopers or litter boxes that have like scratches in them, the plastic one can hide the virus in them, food bowls, bedding, and then any hands or sweatshirts or things, if you've contacted the animal, it can be on you. And we all know viruses are too small to see. So when we have a cage or a foster that has had a positive test within it, we will get rid of everything that can't be thoroughly sterilized. So throw away the bedding, throw away anything that can't be sprayed down. And then we will clean that area with an appropriate disinfectant and let it sit for what's called the contact time. So PanLeuk is actually resistant to quite a few disinfectants. It's important to pick one that works on it. We in particular use Rescue, which is an accelerated hydrogen peroxide disinfectant. Various versions of bleach will work. But the cleaning can be quite involved, and it's really hard when it's not on something that's a hard surface. And then the other thing that I wanted to just mention is when Ashley was talking about prevention and we talked about a vaccine series, those are all things we do at the small individual animal level. But another thing that Michigan Humane tries to do is to look at the cats that come into our shelters and what areas of the communities they're coming in from, and then to schedule targeted vaccine clinics where we make vaccines available to the public in that area, either for free or at a low cost, so that we can help reduce the amount of virus that is able to live in that community by providing immunity to the animals that live there already. And that's something that sometimes it's harder to see in this when you're just looking at one thing, but it's in a way that Michigan Humane helps to try to prevent this disease from ever even coming into the shelter. And I think that's all I had for you guys, but I'm open to hearing any questions you might have, in particular about the shelter animals or anything you've had an experience with.
Yeah, if you have a question, if you want to go ahead and unmute, I'll keep an eye because we only have a small group, so I should be able to kind of see who's unmuting and let you go. Tom, I saw you unmuted. Do you have a question?
Yeah, my question is, once a kitten does get PanLeuk, survives, can they get it again?
So they're considered immune for life, which is great for them for panleukopenia. We do still recommend vaccinating them. It's not for the PanLeuk part of the vaccine, it's for all the other things that they can still get, but they are immune to panleukopenia, which is like a small silver lining.
Thank you.
Yeah.
I saw Barb, you unmuted.
I just have a question in regards to the cleaning. I didn't know if the cats that are infected, their litter boxes and bowls and cages and stuff, are they cleaned in a different area, or are they cleaned along with all of the other things in the shelter? Because I would wonder about, people touching those things, not knowing that they were part of that area, and then moving around and touching other things. I don't know how that would work.
Yeah, so I can answer a little part of that, and Dr. Gary, if you have any more to add after that, that would be helpful. So I know for sometimes, and Dr. Gary kind of mentioned this, we will throw out a lot of that stuff just to reduce any risk of that happening at all. Some of the other things that we can do, and actually ways that volunteers helped with this when it was happening at Berman, and you guys feel free to always do this to help, even if you don't hear about a big outbreak or something, we can always use this. Volunteers were bringing in cardboard, the small can like boxes when you buy like a pack of, canned beans or something, and there's the cardboard that goes underneath it, so that we can use those as litter boxes instead, because those are just cardboard. We can toss them out afterward. We don't have to actually toss out a real, plastic container. So that was super duper helpful. I know a lot of our volunteers brought so many, which is great. And then we'll also do things like giving them food on plates, or little hot dog paper like holders, again, so we can just toss those out if possible. There are from time to time quarantined items that will come down to center maintenance, but are bagged up properly with a sticker that says that these are quarantined and need to wash a special way. And usually volunteers are not required to wash those, because there are so many, if and ands that people worry about. There are a few volunteers who are trained properly to do those, but typically staff will help step in when too many of those are getting piled up. I don't know for sure if any of them are typically this particular virus, but for other viruses that we've had in the shelter, we've done that too.
Okay, thank you.
Jenny.
Hi. First of all, this is really scary to me.
Oh.
Just because I take such little guys usually. The question, I guess, and you answered most of the things that I was concerned about. I was always wondering why they didn't test prior to us taking them home. So you get one that's a couple days old. How long does it take before the symptoms start showing?
Sure. Okay, I will just say the nice thing about bottle kittens is that they spend very little time in the shelter. So they can't spend the night. So their exposure within the shelter itself is actually quite low, which is a little bit nice. The time from when they're exposed to when they could show symptoms is that incubation period. So that 2 to 14 days.
Okay.
But the average is about 5 to 7. Usually for me, when I take a bottle kitten home, I think to myself, if I've made it through the first 7 days, the chances of them showing any symptoms are pretty low, because their immune system is not very developed at that age. So usually if they're going to get sick, it'll be within the first week. And I actually see way less panleukopenia in bottle kittens than I do in those kittens that are 2 to 4 months old, just because they're not moving around and they haven't had a lot of exposure typically.
But they could still get it from their mom.
They definitely can still get it from their mom. Yep.
Okay.
If you make it through the first 2 weeks, though, you're definitely in the clear. And that is one of the reasons why the foster team sometimes elects not to allow mixing of different litters. So we don't want to send a bunch of bottle kittens home in a mix, just because if one of them breaks with PanLeuk, then we've lost all of them.
Right.
But sometimes we will take that risk if it's necessary, because we only have one foster home available, or if it's for the mental health of the kittens, it's better for them to be as a pair. We may elect to do that, but yeah, that's the reason. That's the reason we don't usually mix them.
Yeah. Okay. Thank you.
Yeah.
Victoria, I see your hands up.
Yeah, I just wanted to be reminded again about the safety precautions, PPE for healthy cat areas and then the non-quarantine areas for like the level 2 cats. What are the requirements right now?
So right now, you guys should, I don't think it's been updated, so I think you're still doing gloves between cats in healthy areas. Gowns are no longer needed. Typically, if we have like a room that has been quarantined for something like this, we wouldn't go to the extent that we recently did, where everybody in every single cat area is wearing full PPE. That was because we had quite a bit going on and we were just trying to keep the spread low as much as possible by doing those extra precautions. So I think right now you guys are still doing just gloves between to make sure that we're good, and we haven't heard an update on that as far as I know. In quarantine, actual quarantine spaces, I don't believe volunteers typically go in those rooms.
No.
That is like a cleaning only, staff only thing. Even my cleaning volunteers who help in that cat cleaning and feeding role in the morning should not be helping in that area. That should be a staff member who's been designated to clean that space and then not clean another space. Like usually they work it out that way. So for you guys specifically, just gloves between cats right now.
Okay, and so then cats that are like the level 2 areas where they're just coming in, would I be required to wear a gown? I don't need a gown in that area because they really haven't been tested or.
You're not required. However, I do know people like our director, Eileen, would always say that extra protection is always better. So if it definitely makes you feel more comfortable when you're working, because I know especially for you, Victoria, you're going back sometimes to places that not a lot of my volunteers do. So if it
Right.
does make you feel more comfortable to do extra stuff like that, please feel free. You guys are more than welcome. If you need any of those items, please ask.
Okay. I know those gowns they are hot.
Yes.
I work in a hospital, so I'm used to wearing a gown, but those gowns are super hot. I'm like drenched underneath it after working a couple hours. But
Yes,
thank
I
you.
cannot thank all the volunteers enough for doing that for so many days in a row, several of them being here every single day. You guys were doing awesome. Even if you're not on this call, I want to thank you if you're listening later, because I can't imagine having a cat on you and a hot gown, and those acquaintance rooms at Berman are right in the sun. So I know that they were dealing with a lot of heat. I know it was getting to them. So thank you guys so much for doing that. You're keeping our kitties safe. So thank you. Last hand I see here is Ceci.
Hi, thanks, and thanks for a super informative presentation. I just wanted to ask, through the shelter med side, if we have our own cats, and like we're fostering or volunteering or whatever, are we able to get some of the discretionary vaccines for our adult cats? I know panleukopenia is one of the core vaccines, but I'm thinking like PanLeuk or something. Is that something we're able to do?
So sure, yeah, we always recommend that if you're fostering, all of your resident animals should be fully vaccinated. While we don't recommend allowing them to intermingle, we still want them to be fully vaccinated so that they're protected. The feline leukemia vaccine is something that, you may be interested in pursuing for your adult cat. It would just be something that you would ask about at your veterinary appointments, letting them know that, I foster and I just want to make sure I have this added level of protection. That one in particular is something we recommend for cats who have a higher risk lifestyle. So if you're bringing a lot of cats from the shelter into the home, that would be a higher risk, or if they go inside and outside, that's definitely another risk. But it isn't something that we offer as part of our volunteer perks. Our clinic does offer those vaccines. You would just have to ask about it when you go in for your vaccine appointments.
Okay, cool. Yeah, I was not thinking of it as a perk. No, my vet literally was like, no, we don't do that vaccine.
Oh, yeah. I mean, most of the cats that we're sending into foster are feline leukemia tested, but not all of them. So those tiny kittens often aren't tested yet. So it is something that, would be a good idea. I didn't realize that some vet clinics aren't carrying that vaccine. It's a pretty common vaccine, but if your clinic isn't, the Michigan Humane Society clinics do carry that vaccine.
Okay, cool. Thank you.
And I just want to take a moment here to maybe back off how scary this sounds. So it sounds really scary, and it is scary, but it's not scary if we think about that we're just trying to be aware of it so that we can take precautions to protect our population as a whole. So for me, when I'm looking at cats and kittens, I go throughout the whole building. I see the evaluated kittens. I see the ones that have just come in. I see adult cats, and I am not wearing a gown the entire time. I'm just trying to be cognizant of washing my hands between cats. So if a cat or kitten is apparently healthy and I do an exam, I am not always wearing gloves. In fact, I would say I'm mostly not wearing gloves if they appear healthy. And then I just make sure that I do typical hand hygiene where I just go and wash my hands between patients. And then if for some reason the cat or kitten has gotten maybe a bunch of litter on me or has kind of climbed all over my sweatshirt or scrub top, then I may just change the top if I think that they were at risk. But most healthy appearing cats are not shedding virus yet. They typically are shedding the virus when they are symptomatic or shortly before that. So as long as you are trying to prevent your entire wardrobe from being contaminated, so maybe holding them in a towel or a blanket if you're going to snuggle them on your lap, and washing your hands between patients, that's typically good enough. It is not as scary as it sounds. Usually we just want to know if this cat looks sick, let's try to be wearing the gloves and gowns. I know right now we are still recommending wearing gloves between cats. That is just an added protection so you can throw them away. But hand washing where we're really sudsing up and doing it for 5 minutes or at least 3 minutes is typically adequate. And thank you guys so much for all your time socializing and cleaning and washing things and fostering. You guys are so amazing and we couldn't do it without you.
Definitely. Any other questions? Feel free
I
to
have a general question.
go ahead, Margaret.
Thank you again. This was super informative. The more I know, the more I find out I don't hardly know very much. So this is great to have this added benefit of this knowledge. I have a question about the vet services. Our vet has just announced that they are closing, but I've always been kind of afraid to try the Humane Society vet because it seems like I hear that it's always like super booked. Is that true, or is it something I should try, or should I just find something locally to replace, my current vet that's closing?
So I think it just like a lot of businesses, COVID has sort of made it so that we were a little bit backed up, and the books they open up scheduling like a month at a time. I'm not really sure because I'm not in the clinic at this time. I think it is a full service clinic with really wonderful veterinarians. I just can't speak to this current scheduling status right now. I'm so sorry if that's the rumor that's going around, is that they book out super far. I guess that means that a lot of people are interested in healthcare for their pets, which is wonderful, but I don't have any answers about that specifically right now.
Fair enough. I'll just give it a call and see where it gets me. Thank you.
Yeah, that would be my recommendation, Margaret, is to call and see and just ask them that same question of like, how busy are you guys typically? Our call center does a wonderful job of talking those things through with people. And so they'll be able to kind of give you an idea of that. It also probably just depends on a lot of what we're seeing at the clinic and how many of those different types of things we can get through at a period of time if we're seeing a lot more of something than another thing. So yeah, I would just definitely call our main number and talk to the call center and they'll be able to help you more.
Okay, awesome. Thank you, Ashley.
Of course. The last thing I just wanted to throw in here, if we didn't have any more questions, was Dr. Gary talked briefly but wonderfully about our community clinics and the way that we outreach to help with situations like this. That is something that I think several of you have done or at least are aware of, but if you have not, you're more than welcome to volunteer for those. There's no prior training that is needed for that. And it's always super rewarding. So those will show up in your service profile as One Health events. And we are starting those, I believe, in April. And sometimes they're at the shelter, sometimes they're in the community. It just depends on what is needed and where. So that's what Dr. Garrity was talking about, is sometimes we will have clinics in areas that we know has a high need for a specific reason. So if that is something that you're interested in helping do, or at least learn about and what that looks like, please feel free to sign up for those One Health events. Every time I have volunteers there, they are ecstatic about how the people leave, and they're telling them, I couldn't have, taken care of my animal if this event wasn't happening. I wouldn't have been able to afford it. They're always so grateful, and it's wonderful to see. So if you get a chance when those pop up, please sign up. We would love to have you there. Okay. Well, if there's no more questions, thank you so much, Dr. Garrity, for this. This is wonderful. We look forward to having another one of these very soon, hopefully. And you guys, if you have any suggestions on anything about the shelter or any disorder or disease or anything that you've heard of that you would like more information for another one of these, please feel free to email those to me. And thank you guys all for coming, and we'll wrap it up. Thank you all.
Hey, Ashley.
Thank you.
Oh, somebody said my
Ashley,
name.
just one thing.
Yeah.
On the One Health clinics,
Mhm.
what would greatly benefit our volunteers and fosters is if at some point in time they had something like that for fosters and volunteers. We're more likely to take on more animals, but as you all know, each animal is very costly these days, between vaccinations and heartworm and flea and tick and whatever else happens. It would just be a wonderful benefit for staff, volunteers, and fosters.
So yes, that sounds wonderful. I will talk to the powers that be that put these all together, because there are some things related to who gives us funding for them and whatnot, and how often we can have them. However, you guys are more than welcome to also sign up if you are in need of this care. This is open for the community. So sometimes there are a little bit of like an application process of what is needed for you. But a lot of times it's you sign up for a time and you come in, and it's either, it's a low cost of whatever we're offering at that location. So this is to friends that need it, whatever is needed. If you need to come personally, you guys are more than welcome to come as a guest for that too.
Okay.
Yeah.
Thanks.
Okay. All right. Thank you guys. I hope you all have a wonderful rest of your day. I'll talk to you later.
You too.
Thank
Thank you.
you.
Bye-bye.
Bye.
Bye.
Bye-bye.
Thanks, everybody.